So next up on the agenda, we have an interesting debate. For this, I would like to call up on the stage the referee of the debate, Dr. Amit Kumar, the AI man from Kolkata. The topic is use of AI in day-to-day clinical practice. Is it really working? The two debaters are Dr. Hamid Ashraf from Aligarh and Dr. Rupam Das from Guwahati.
So, good afternoon, everyone. And I believe we had a very good session in the beginning, understanding about precision diagnosis and machine learning. So now we'll try to understand that in real world practice, is AI really helping clinicians? So before we start the debate, let's have a little opinion of the house. How many of us here in this room have used ChatGPT or have started using ChatGPT? Right, so I think most of us have used. Now, how many of us during our clinical practice have exposed ourselves to asking a medical question to ChatGPT or any other language models? Okay, that's a lesser number of hands. So now this is the debate. So we have two speakers, Dr. Hamid Ashraf, and we have Dr. Rupam Das from Guwahati. And they will be debating with each other. I think Dr. Hamid will say that yes, it can really help clinicians at the moment, and Dr. Rupam will be speaking against it, and at the end, I'll come in with my comments. I'll let them to introduce this.
So I would like to call upon the stage Dr. Rupam Das. I would like to call upon Dr. Hamid Ashraf, Professor and ex-director, Rajiv Gandhi Center for Diabetes and Endocrinology, Aligarh Muslim University, Aligarh. He is the RSSDI USB Innovation Award for 2024. He is the recipient of first prize in ESI COVID Ideathon 2020. He has various publications. So the stage is all yours, sir.
A very good afternoon to all of you, and thank you, the team Diabetes India, for giving me this opportunity. And this is something very important to talk in today's current practice. The use of AI in day-to-day clinical practice, is it really working? So I will be debating for yes, because that's what I also believe, and we are using it, and we can see how the things are improving or things are changing. No, change is the only constant. Since the childhood, we are listening to this thing that परिवर्तन संसार का नियम है और परिवर्तन हो रहा है और ये now it is knocking at our doors. So if you have a small, you can say something comes to the market, and after that there is a bloodbath in the US share market, more than 1 trillion is lost. So it means that there is something which we cannot ignore now. So this is just because one this DeepSeek, the AI from the China was launched, and it led to a bloodbath in the US stock market. It means there is something, so that's why there are so many things are there कि जहाँ पे धुआं होता है वहाँ आग ना हो, चिंगारी ज़रूर होती है. So definitely AI is something which is coming in a big way in our day-to-day life, and the clinicians will also not be separated from that. So AI and machine learning, AI is a very broad term. After that, it is machine learning, and if there is self-improvement of that program, and the machine learns from the data by itself, and the data is very big in that situation, there is deep learning. And these are different kind of things where we can use artificial intelligence or digital technologies. You can see from the pharmacy, from the hospital, research, lab, outpatient clinic, education, you name it, anywhere, you will find it everywhere. So whatever the work we are doing, especially when I talk about these things, especially in our country where there is resource constraint, in that situation this becomes very important. The technology can help us in a big way to overcome the resource constraint which we have, where the technology can help us. So because I am an endocrinologist and we are speaking at a diabetes forum, so I will keep my talk regarding diabetes only, use of technology in diabetes. So we all know that the CGM is there, and it is a small kind of device which can be applied to your arm or abdomen or thigh, anywhere you can apply it, and it is a painless kind of thing. The thing is that CGM measures blood glucose every 5 to 10 minutes or every minute or more frequently than that, and it can give you a data. Once you have data, that can be analyzed, and that the predictions can be made because by the AI, and then can be help in improving the patient's outcome. So here you can see we have three patients, patient A, B, and C. All of them has HbA1c of 7%, but if you see the time in range, so this is different. Mostly in one person you have 100% time in range, in other it is 63, and in another in just 25% time in range. So HbA1c is definitely, it's a very much validated marker. We should use it. There is no denying fact. All the outcome parameters of diabetes which has been analyzed, it has been analyzed against the HbA1c, so we should use that. There is no denying fact, but the HbA1c itself is not complete, because what HbA1c tells is that is the past. And what this CGM tells it is the present and future. So if you look at this SMBG diagram, sorry, pointer is, I think it is not working on there. So if you look at the SMBG chart of this patient here, you can see that all the blood sugars are within normal values. तो ऑल द ब्लड शुगर विद इन नॉर्मल वैल्यूज, लेकिन जैसे कहते हैं कि पिक्चर अभी बाकी है मेरे दोस्त, तो ये जो पिक्चर है, जो बाकी पिक्चर है, वो दैट विल बी टोल्ड बाय द CGM. So here you can see even the SMBG values are normal, but there are so many ups and downs. This can be tracked only this, and with the help of AI, this prediction can be made, and the changes in the dose of insulin or OHA or anything like that can be made. And glucose availability is definitely not apparent. Glucose availability is one of the parameters which is now we commonly talk about. And the more up and down in the blood glucose level is associated with worse outcome. And these are different kinds of CGM which is there, and I'm not going to discuss about this. And if you are managing diabetes, then definitely it's like walking a tightrope, because we have to choose, many times we have to choose between any one of them, especially if I talk about type 1 diabetes. If you try to bring the HbA1c less than 8.5, then hypoglycemia is the rule in these patients. And hypoglycemia is very frightening to the parents, and by MSI and MDI you cannot, you can say, prevent that. There is no way we can abolish that, but with the use of, and another problem with these injections and all those things are that you can comprehend almost 1500 shots per year just for the survival. I am not talking here about the quality of life, the hypoglycemia, hyperglycemia, hospital administration, all those things I am not talking. Just to stay alive, patient need at least 1500 shots per year. That is a big problem. So we have insulin pumps. So pump is like any other pump. That's not a big issue. What in today's world, what is the issue is that if we have a sensor augmented pump, AI based pump, which can stop the delivery, which can give the insulin, because bolus dose, insulin carb ratio, and all those things, they are very difficult to understand by the patient. Most of the patient, they cannot comprehend those things, so it becomes very difficult. But with the advent of technology and with the help of closed loop, when the patient don't have to do anything, you just need the pump and everything will be done by that pump. And now we have bihormonal pump also, which has insulin as well as glucagon. And these things definitely, with the help of different algorithms which can predict the hypoglycemia and hyperglycemia, and there are apps which can calculate the carbohydrate amount, which can calculate the dose of insulin. All these things definitely is going to help patient in a big way. And one of my students, he was an MBBS student, he developed pancreatitis. After that he had diabetes, and his sugars were very fluctuating. And all the time he was worried about that. He asked me, sir, what I can do, because I am not able to focus on my studies. I have to give NEETs, this PG exam. Please help me out. I told him, if you want, you can try the pump. And after taking pump, the patient was definitely, he was affordable, he can afford it. He purchased it on an EMI basis. And the patient has done, he is doing very well. Now he has got MD secretary also in our college. So things can be changing, because it can be life-changing experience for the patient, because the hypoglycemia is, you can say, we can prevent hypoglycemia. So this is very, one of the earliest publication in 2008, which has shown with the use of insulin pump therapy, even without AI, it was associated with 4 times lower episodes of hypoglycemia. So definitely things are going to improve if we have sensor augmented pump. And now we have some data that it also leads to decline in the mortality and all those things. And there are certain works which we have done in our college. So along with my computer engineering and AI department, we applied this deep learning and machine learning for the detection of diabetes. Here you can see almost 800 and almost 13 or 1400 patients we have included, and we have taken their iris and conjunctival image. And after that, we have analyzed that data set with the help of AI and DL, and you can see a very good, almost 90% accuracy was there. But another thing is that risk prediction is very important. So we have tried to see the risk of diabetic nephropathy with different kind of parameters which we have. So this was the process, and total 40 features which is usually available in most of our patients, including fasting blood sugar, postprandial, HbA1c, BP, all those things. We have incorporated that data into the system, and after that we have seen that almost 0.95, this is the area under curve was very high, and almost 90% prediction can be made with the help of these 21 parameters that this machine learning can tell us that this patient is going to develop diabetic nephropathy, and they are not, and another person is not prone to develop diabetic nephropathy. So another use of technology is that this is the SWIM card which we use for our type 1 diabetes patient who are not affordable for insulin pump therapy. In that situation, here you can see this is a very easy thing that we enter certain data of the patient, and after that we just tell the patient to count the number of carbohydrate exchange. And if the carbohydrate exchange is, for example, 4 and the patient's blood sugar is 108, so in that situation patient needs to take 10 units of bolus insulin. And you can see not all the patients respond very well, but at least few patients can do very well. You can see the HbA1c of 16, now HbA1c of 7.6 with the use of this. And now another use of AI in cancer and all those things, we know that in imaging, because pattern recognition is a thing which is very much, you can say, it can be done very well by the artificial intelligence. So many of the studies, they have shown that this AI can detect cancer more accurately and this is coming in a big way. And another thing which was, I was looking for virtual DCCT. From the data of HbA1c and SMBG 7-point blood glucose, they have made this chart, this CGM chart, and they have shown that good efficacy of this for this. And other academic was, for example, replying your email, reviewing article, summarizing article, finalizing topics for seminar and conference, designing the studies, calculating sample size. There are so many other things which can be done with the help of AI. My students are very happy because now I'm burdening them less, because most of my work now I'm doing by using ChatGPT and others. So that's all. Thank you very much for your patient listening.
Thank you very much, Dr. Ashraf. You gave an overview about a rough use of artificial intelligence in diabetes and metabolic care, the positive sides. So when you try to look at the use of AI, there are two segments. One is as doctors as the end users. I think this was the topic, that can it really help clinicians in clinical practice? And the second is the patient as the end user. When you look at doctors at the end users, you're looking at AI tool should help your work easy. So one of the biggest use cases is using an AI scribe. How many of us in this hall is using an electronic health record system, electronic medical record? All of us, right? And you spend a lot of time in typing, and that kind of disconnects you with the patient. So you don't get to look at the patient eye to eye and connect with empathy. So with the help of AI, especially generative AI, you will be getting an option of using speech to text transcription, and an AI scribe can actually help auto-populate the electronic health record. So while you speak to the patient, your electronic records are getting recorded. So that's one use case. The other use cases Dr. Hamid has mentioned, there is a fantastic use case of using convolutional neural network in retinopathy screening, and same is also being used in thermal images being picked up for diabetic foot screening. So you can pick up foot ulcers much earlier before they have developed. You can use pattern recognition and risks prediction score. He showed in the field of nephropathy. And of course, the insulin pump works a bit on AI, not completely on AI. There's a PID algorithm that is there, but now the newer insulin pumps, which are FDA approved, the beta bionic pancreas and also 780G of Medtronic has got a layer of machine learning that is coming in. So that is adding more fine-tuned response to the adjustment of the basal and the bolus dose. That's the end user as the clinician. The other end user in this case is patient. One of the biggest use cases of AI, which we will all find, is in diabetes self-management education using virtual chatbots. This is a big use case tool where patients can have a connected care with an AI as a support, as a mental support in diabetes distress, or as a chatbot to give them patient education and resources. But the question we are trying to ask here is that is it really making a difference, A, in making the job easier for the clinician and bringing more clinical outcome, better clinical outcomes in terms of compliance or reduction of A1C, etc. in the patient. So Dr. Ashraf has showed us the positive sides, and now I think Dr. Rupam Das will tell us that the negative side of it. So I'll hand over to the chairpersons to introduce Dr. Rupam Das from Guwahati.
So countering Dr. Hamid is Dr. Rupam Das. He's an MD, FDIAB, FRCP, CCR, Chief Consultant Diabetologist, Dr. Rupam's Diabetes and Foot Care Center and Managing Director, Sanvi Healthcare. He's also a course director, certificate course in diabetology, RSSD accreditation. He's been a principal investigator for various global and domestic trials, speaker at various regional and national forums. Welcome you, Doctor.
Thank you. And foremost, I should thank Dr. Bansi Sabu sir for giving me the invite and Team D Genius. Today's first, my able competitor had already mentioned one very scary point about DeepSeek. That in one day, US lost 1 trillion. So AI can be very tricky also. It's not that it's all helpful. So I'll be talking about, I'm not supporting in clinical practice. AI, from the previous speaker, I can understand that what he has shown is little digital technologies, how it can be helpful. But what AI per se we are trying to discuss today is about ChatGPT and those sort of things. That is a very complex thing. It's not very simple that we ask a question, they give a diagnosis, they give a treatment, and we give the treatment to the patient and they go home. So easy. In one way, AI in healthcare, it's beneficial in cutting the manpower cost, or that time may be little beneficial, which we can see. But in the long run, there are certain implications why it may not be so helpful also. There are challenges of AI in use of AI in healthcare, like professional liability. If we are depending on an AI, who is liable? Whether the AI is liable for the treatment or the doctor himself is liable for the treatment if anything goes wrong. Ethical and privacy related challenges are there. We are using the patient data. There are sensitive data we are using, and that has to have some privacy. And that has been asked again and again with Google. We all accept that. So that is another point where we have to look into. And talking about the vast majority of clinics, I'm not talking about just one standalone clinic where AI is very much useful, but the vast majority of clinics across India, and we know that 70% is rural. Only 30% is urban, clinics will be there, and urban population. So lack of understanding also will be there. It's not uniformly people will be educated about the AI use. I'm not talking about the health technology. Technology use can be done in any place, like CGM or anything. Whether it is available locally, that can be used, but that is not exactly AI. AI is using ChatGPT or certain sort of machine learning things where it can be helpful to us. But for that, we have to be updated also. It's not that app will be given and we'll use the app and everything is all set. It's not like that. We have to understand how to ask the question to the AI. Some unreliability and trustworthiness of AI technology is there. All are not equal. And Which to believe, which not to believe, that's again a critical question. So complexities, if we talk about integration of artificial intelligence, mostly it will be ethical and social challenges. That is, who will be accountable for concerns of AI decisions. There will be risk of data bias and transparency issues will be there, and trust and acceptance among the practitioners and patients. Some governance challenges also may be there because they need some regulatory compliance to be followed. At the current time, I'll say AI is evolving. It's not that all set so that everybody can use in our clinics. It's not in that stage. It is moving forward, but it is not in that stage that everybody can use openly. I think recently ICMR has given some guideline about the AI thing, but it is not yet so, straightforward. Technical challenges are there because we have limited IT infrastructure and data privacy concerns, and certain disadvantages of AI may be there because difficulty in data accessibility and quality. And sometimes you fear job replacement also of the healthcare workers, because if you are using the AI, then there will be some job losses also, because some things will have to cut down and use the AI to do the job of a certain group of people associated with the healthcare. There will also be biases while using the AI. There may be a bias in formulating the research problem, how we ask it. Every time we ask it, there will be a different answer. It's not the same answer every time. Data collection also may be a bias may be there, because some data may be represented, some may not be represented. And the AI machine will collect all the data and collate it together. So bias definitely will be there, and data pre-processing bias may be there, like aggregation bias or selection bias or outlier bias or confounding bias. So those sort of things will be there in processing the data. Validating the tool is another thing which is lacking at the present time. There are a lot of AI things are available, but validation of the algorithm, which algorithm is correct and which can be used by each and every one of us in our clinic, that is not yet done. Why clinician remains irreplaceable? It seems like if we are using the AI, everything is going to be done by the AI and we'll lose the human touch. We have to have that human touch. We have to have compassion for the patient, empathy for the patient. AI will be only looking into the data and giving a solution. So that we need to keep intact, and that's another point where it may not be so helpful. ChatGPT and medical diagnosis, definitely you can see it's being used by many of us, but accuracy and reliability may be a factor, because ChatGPT is trained on publicly available data, which may include inaccurate and false information also. It will search the entire World Wide Web. It's not going to search just one thing. So there may be false data also which will come into the ChatGPT data information. And that risk of misinformation or overshadowing the genuine scientific evidence might be there. Some medical supervision is needed. Patients should consult a healthcare professional before acting on ChatGPT, because the patient also will be using the ChatGPT. Not only the doctors will be using it for diagnosis, but the patient also himself will use it to have a diagnosis, and then will look for a treatment option. Hallucination phenomenon is also there. Dr. Amit might be familiar with it, because that also might produce some untrue or misleading responses, or variability in response will definitely be there. Every time we ask the same question, we might get different answers. So, issue of responsibility, um, it's not apparent that who is to be blamed when there is an event in system failure. If we are relying on a chat GPT for a diagnosis or treatment, if some failure is there, then who is to be blamed? We know that doctor is to be blamed, but then again, those sort of legal things also come. It may be hard to pin the blame on the doctor when they had no part in developing or overseeing that algorithm. And the developer being at fault may appear unrelated to the clinical setting. So these are little things which may be little not so comfortable with using the ChatGPT in our day-to-day clinical practice every time. And there are no guidelines currently for the moral use of AI in or machine learning in the healthcare. So some guidelines and some norms have to be followed so that it is universally acceptable and being used by most of us. Mostly the ethical implications are concerning and that we need to be aware of, and we have to look into the biases and accountability, transparency, and foremost we have to retain the human touch. So overall what I say, ChatGPT or use of AI in our day-to-day clinical practice in the clinics across India, it's not really happening at the present. Maybe some improvements or some acceptance will be required for incorporating in our practice, in our daily practice. I'll stop here and over to.
Well, thank you, sir. Now I would like to invite on the stage Dr. Ashraf for a meaty note joke.
So we had both the speakers kind of give their viewpoints on the positives and the negatives of AI. Any quick rebuttal from any of you?
Yeah, I just wanted to say that definitely if the risk is very high, then definitely the things which we are getting because of AI, that is also very high. Because once the computers were there, everyone was that if computer will come, then the employment and everything will gone, and what will happen to privacy and everything. UPI came, everyone was skeptical that our accounts will be trained by someone else. But now we are using it. Everyone is using it, even a chai wala and phal wala, and everyone who is coming to our, everyone is using it. That's how things evolve. And I fully agree with Rupam Das. Definitely, it has its own, you can say, problems at this moment, but we need to embrace it because the change is there and it is knocking at our door. And one thing which I fully agree with him, we cannot, that chat GPT or anything cannot give the human touch. So doctors are there, they will stay there. And only thing is that if we incorporate all these things in our clinical practice, our practice will improve, the patient satisfaction will improve, our, you can say, burden will be lessened, and so many things, because we work in a resource constrained setting. So I think India is a country where we should use these things optimally, because we don't have that kind of clinics where we have podiatrist, we have diabetic educator, we have diabetic nurse. We don't have that kind of practice. Everything has to be done by us. So in that situation, utilizing this technology can help us and our patient and improve our clinical outcome. That's all I want to say. And I fully agree, whatever the concerns are raised by my learned colleague, I'm fully aware of that and I acknowledge that.
Both the speakers seems to be shaking hands and agreeing with each other, but this is supposed to be a debate. Dr. Rupam, you want to counter or say anything to it?
I think my able opponent has already agreed upon what I have said. I don't have anything
So
else to
we
say.
should have both the speakers in the middle, and what we will do is we'll take one each question from the house. Thoughts, comments, anybody to the speakers? Before I conclude, please. No problem.
Hello. Yeah. Well done, both speakers. Conclude, it's like marrying a robot.
Yeah.
So there is no conflicts doing whatever you are asking you, but there is a lack of human touch. But the problem is with AI, without AI is like a giant feeding on your data. The more you give, the more it grows. Whether to give our patient data to AI or technologies is right. I think whether we should.
I think Dr. Rupam, you want to take this question?
I already spoke about it because data privacy needs to be retained. That's foremost. And even doing clinical trials and all, we take the consent of the patient enrolled in the trial before going into any data collection. So here, if we are giving the data to the AI, all the patient data, that may be one issue which definitely will be there.
So how do we address it ethically?
So in these early days of artificial intelligence, we are looking at both the ends of the spectrum. We are seeing that AI has an immense potential of not just transforming healthcare, but literally transforming the way we practice. I just spoke about an example of how you can actually use an AI scribe to auto-populate your EMR. Remember, the essence of technology is in its simplicity. The more simple the user interface is, the better the technology will be adopted, both by the clinician or by the patient, and better it is going to be effective in improving the day-to-day outcome of that particular individual. And we know that with a simplistic use of natural language processing or a ChatGPT-like tool, or let's say a medical language model, as and when that comes, there is an immense possibility that it is going to be one intelligent assistant that will enable, and I'm using the term enable, a clinician, not replace a clinician, but enable a clinician to possibly take better clinical decisions at that point of time as an individual. And this is the immense potential that AI holds. So we should imbibe this. But having said that, there is a lot of gray clouds in the sky. And some of these gray clouds have been mentioned and highlighted by Dr. Rupam Das. And one of the most important points is the ownership of the data, the privacy of the data, the explainability of the model, the transparency of the model, and the guardrails which need to be set. Now, it's too early days for us to really give a definitive answer to each and every point, but this is a process which is in development and which is going to evolve. As clinicians, as individuals who will possibly be using AI tools, whether we want it or like it or not, in the days to come, it's our responsibility to also participate in setting these frameworks and guidelines as and when we get an opportunity to. So the answer to your question, Dr. Ashwin, is, well, data, who is the owner of the data? In one line, patient is ideally the owner of the data. Neither the service provider nor the doctor, nobody is the owner of the data. B, regarding data privacy, I think we are going to get AVDM compliant very soon, and we will be having layers of privacy coming in. Different countries have got their own global individual country-wise policy. The HIPAA Act is there, the EU Act is there. Each places there are guardrails to protect the data privacy. So data privacy shouldn't be a problem that should pull us back in utilizing this particular technology into better patient care. The question about transparency of the model, explainability of the model will come when we will be working with a larger set of data in a more regional set of settings. Like, for example, he's been working on a machine learning model to predict nephropathy risks. So we could have hospital-based model algorithms which could actually be run on a local database to give a prediction in the electronic health records. So I would say to conclude, there is a huge potential that we see artificial intelligence holding for improving healthcare and improving the approach in which a clinician practices. At the moment, there is huge potential of using machine learning, deep learning for prediction and reaching towards more precision diagnosis. I think that's in the level of research. In hardcore clinical practice, there will be language models, small language models, that will possibly be enabling a clinician to take better decisions when they're using the electronic health record. The question of privacy and data security will have to be answered with the law of the land being in place. We have the DPDR Act. You can just Google search it and you can find out about the DPDR Act that speaks a little about the digital data protection, but it's still very vague, still not yet implemented in its full. We as clinicians must have to be curious. We must learn to adopt to this change that is happening. We must not shy away from digitalizing our health record just for the sake of privacy and security. Because at the end of the day, only when your data is structured you will be able to derive some information out of it. And from that information, we will be able to derive some intelligence out of it. And that will be the true power of artificial intelligence in changing the way we look, perceive, and practice medicine. Once again, I would like to thank both the speakers. I think they did a fantastic job. It is a very difficult question to answer in a debate whether it's useful or not, but we definitely feel it is very, very useful. Having said that, we must use it responsibly, effectively, and ethically. Thank you very much. I'll hand over to the chairperson.
Definitely, we would thank both the speakers, but I think the referee stole the show over here. So please, a round of applause for Dr. Amit, sir. Please, please.
And I would also request all of you to get a copy of this book. This was the first book of India where we just gave a highlight of what AI can do in healthcare. This is available with JP Publishers. I think the online link, we'll put it up in the D-Genius group. And it was released last week at Epicon. Thank you very much.
We'll just get a
have
quick photo
group
here. Please stay on the stage.